Hello, I'm Dr. Renee Young of Young Naturopathic Center for Wellness in Los Gatos, California. Today we're going to talk about 3 genes that you can have tested to assess your risk of heart disease. In 2016, there were 610,000 deaths from heart disease. That's 1 out of every 4 deaths. I am sure that you or someone you know has been affected by or heard about heart disease. Some of the things you may not have heard about are what genes can potentially affect you and increase your risk. I want to preface this by saying we have over 100,000 different genes. You can't know everything about a person by just knowing a few. So don't get on Dr. Google with this information, freak out and be like, I've got that gene. Make sure that you look at the bigger picture. That's what we do in our clinic. We look at your other labs, your lifestyle, your diet, and figure it all out. All right, guys, here we go. Gene number 1, apolipoprotein E. So, ApoE is a gene factor that you get 2 copies of, one from your mom and one from your dad. There are apolipoprotein E2, E3, and E4. It's been shown in studies that people who have a particular combination of this genotype, particularly involving apolipoprotein E4, tend to overproduce cholesterol. The overproduction of cholesterol can contribute to heart disease. Now, I believe heart disease is an inflammatory disease. It's not just about your cholesterol, but certainly if you've got a bunch of mud, you're gonna clog the pipes. So there's gotta be some level of rationale to cholesterol. Let's make sure we're being intelligent about it. Get your apolipoprotein E genes tested, and we can decide whether or not your high cholesterol should be treated with a traditional drug therapy or something natural to help reduce your risk of heart disease. Number 2 is factor V Leodin. So factor V is a clotting factor. So this is one where if you have this particular gene, you tend towards having blood clots. Blood clots can increase your risk of heart disease and stroke, and we'd really like to prevent that from happening. Someone who has this particular gene in our clinic, we may recommend that you go on a baby aspirin or that you take things like fish oil to help thin your blood, or nattokinase. We've got all kinds of things to help if you have this particular gene variability. Now, the last gene is my favorite gene to talk about, the MTHFR gene, and not just because it looks like the word mother, you got it, MTHFR. Okay, so the MTHFR gene is a gene variability that's seen in about 40% of the population. This particular gene variability can be really benign and cause no problem, or it can cause some major issues. When you have the MTHFR gene, you don't process folate, B12, and B6 the same way to reduce something called homocysteine in your blood. I know, wah, 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 wah. We'll test it, don't worry about it, you don't have to remember this. Just remember the gene. MTHFR gene raises homocysteine. Homocysteine I often describe like getting road rash. If you've ever gotten road rash or a rug burn, every little piece of lint can stick into a scab. Homocysteine increases inflammation. The inflammation of your blood vessels is what increases your risk of heart disease and a cardiovascular incident. So if you feel that you have a family history that puts you at risk for heart disease, please give our office a call, schedule a consultation, and we will be happy to tell you how you can get your genes tested to figure out your risks. We recommend our patients run their labs every 6 months in our well visit checks to make sure you have a reduced risk of heart disease and stroke. So if you like this video, please remember, pass it on to a friend, like us, send us a comment. We always love to hear from you. And as always, be well.
Thank you for watching. For more tips and free updates on how you can be well, please download our free special report, The 9 Hidden Reasons You Are Sick, Fat, and Tired, at youngwellnesscenter.com.